How do people get infected by Salmonella? A comprehensive guide. Salmonella is one of the most common causes of foodborne illness worldwide. It is a genus of bacteria that can cause gastrointestinal infection in humans and animals. Infections range from mild symptoms to severe illness requiring hospitalization. Understanding the various ways people get infected by Salmonella is essential for prevention and public health. This article explores the many ways Salmonella infects humans, including contaminated food and water, contact with animals, environmental factors, cross-contamination, and individual risk factors. 1. Contaminated food, the most common route. Most cases of Salmonella infection result from eating contaminated food. These bacteria can survive in various food products if they are not cooked, stored, or handled properly. A. Raw or undercooked eggs. Raw eggs can harbor Salmonella inside the shell. Common risk foods: homemade mayonnaise, Caesar salad dressing, raw cookie dough, and eggnog. B. Raw or undercooked poultry and meat. Chicken and turkey are often contaminated with Salmonella during slaughter and processing. Improper cooking allows bacteria to survive and cause infection. C. Unpasteurized milk and dairy products. Raw milk and cheeses made from unpasteurized milk, like certain types of soft cheese, can be a source. Pasteurization kills Salmonella and other harmful microbes. Contaminated fruits and vegetables. Fresh produce can be contaminated by improper washing, contact with animal manure, contaminated irrigation water. Leafy greens, tomatoes, cucumbers, and melons have been involved in major outbreaks. E. Processed and ready-to-eat foods. Peanut butter, cereal, spices, and frozen meals have all been involved in Salmonella outbreaks due to contamination during processing. Contaminated water. Drinking untreated or contaminated water can transmit Salmonella. In areas with poor sanitation, Salmonella can spread through sewage-contaminated water. Even recreational waters like lakes, rivers, or pools can carry the bacteria if animals or humans introduce it. 3. Contact with infected animals. Salmonella lives in the intestines of many animals and can be passed to humans through direct or indirect contact. Reptiles and amphibians, turtles, lizards, snakes, and frogs often carry Salmonella on their skin and in their droppings. Children under 5 are especially at risk. B. Poultry and livestock. Handling baby chicks, ducklings, or farm animals without proper hygiene can lead to infection. Farms and petting zoos can be hotspots if hand washing isn't enforced. Pets, even healthy-looking ones. Even dogs and cats can carry Salmonella in their feces. Feeding pets raw diets increases the risk. 4. Cross-contamination in the kitchen. Even if food is cooked properly, contamination can occur through poor kitchen hygiene. Using the same cutting board or knife for raw meat and vegetables. Storing raw meat above ready-to-eat food in the fridge. Touching contaminated surfaces, like countertops or sink handles, and then handling food. 5. Person-to-person transmission. While less common, Salmonella can spread from person to person through fecal-oral transmission if an infected person does not wash their hands properly after using the toilet and then touches surfaces or prepares food. In caregiving environments like nursing homes or daycares, close contact can facilitate transmission. 6. High-risk environments and occupations. Certain environments increase exposure to Salmonella. Food handlers and restaurant workers, higher risk of spreading or contracting bacteria if hygiene protocols are not followed. Healthcare workers may be exposed when caring for infected patients. Farmers and veterinarians, frequent contact with animals and animal waste. 7. International travel. Travelers to areas with inadequate sanitation and food safety may be exposed to contaminated food or water. Travelers' diarrhea can sometimes be caused by Salmonella. Eating street food, uncooked produce, or drinking local water increases the risk. 8. Improper food storage. Storing food at incorrect temperatures allows bacteria to multiply. The danger zone for bacterial growth is 40 degrees Fahrenheit to 140 degrees Fahrenheit, 4 degrees to 60 degrees Celsius. Leaving food out for hours after cooking makes it a breeding ground for Salmonella. 9. Improper food handling practices. Not washing hands before handling food. Not cleaning surfaces between food preparation tasks, using contaminated dishcloths, sponges, or towels. 10. Immunocompromised individuals, higher risk. Some people are more vulnerable to serious illness from Salmonella: infants and young children, pregnant women, elderly adults, people with weakened immune systems, e.g. cancer, HIV, diabetes, organ transplants. For these individuals, Salmonella infection can lead to severe diarrhea and dehydration, bacteremia, bacteria entering the bloodstream, complications like reactive arthritis. How Salmonella enters the human body. Salmonella enters through the mouth and reaches the intestines, where it invades the intestinal lining. In most cases, the body fights off the infection, leading to symptoms like diarrhea, abdominal cramps, fever, nausea, and vomiting. In some severe cases, it can travel to the bloodstream and spread to other parts of the body, requiring urgent medical treatment. Preventing Salmonella infection. Here are essential preventive tips. 1. Cook food thoroughly, especially poultry, meat, and eggs. 2. Avoid raw or undercooked eggs. 3. Wash hands frequently, especially after handling raw meat or using the bathroom. 4. Keep raw and cooked foods separate. 5. Wash fruits and vegetables thoroughly. 6. Refrigerate food promptly and keep it at the correct temperature. 7. Avoid raw milk and products made from it. 8. Practice good hygiene around pets, especially reptiles or baby chicks. 9. Avoid food prepared in unsanitary environments, especially when traveling. Conclusion: Salmonella infection is highly preventable, yet it remains a major global health issue due to the many possible routes of contamination. From raw eggs and undercooked meat to contact with animals and poor hygiene, the risks are everywhere. Understanding these pathways can empower individuals and communities to implement better food safety and hygiene practices, reducing illness, protecting vulnerable populations, and preventing outbreaks.